Dr. Tyler Williams with Pinecrest Dental. Thanks for taking a minute to watch this video. Today we're talking about Invisalign and cost and what's involved in straightening your teeth or getting a new smile and what options you have. And you're here because you've probably looked into some different options and you're wondering which one's the best for you. And it's a great question. And at the end of the day, there are usually a couple ways, not unlimited or a ton of ways, but there are usually a couple ways that are best for each individual patient. So what your friend or your family member or your spouse or sister or brother had done may not be the best fit for you based on a number of reasons. So when it comes to straightening your teeth, we see everything from home aligners over here, which is when you have kind of a do-it-yourself teeth straightening, all the way to 3 or 4 year braces, sometimes surgery involved, and even patients who we see that have sleep disorders, or we help with, we treat sleep and snoring disorders, sleep apnea and snoring. There are aligner systems to treat people with those kind of disorders too, right? Most of our patients, most people watching this, like you, probably looking at a couple options. So you have your metal braces, tried and true, been around a long time. They work well and get the job done, and the technology continues to improve there as well. For a lot of adults, they don't like to have the metal braces. You don't want to look like a teenager or a kid, or maybe the metal looks uncomfortable. So we also do a lot of white braces. Okay, they're just like the metal ones, 90% the same, but they're white instead of metal. So they're still cemented to your teeth. Keep them on for anywhere from 5 months to 18 months in most cases. It allows us to straighten your teeth, and we do more of the work for you. So you don't have to change aligners and those kind of things out, but you have to have this hardware in your mouth for that whole time. And then you get into aligners, where you kind of have two different categories. You have the office-made aligners, and then you have the do-it-yourself aligners. From there, you go down to the retainers. Okay, so if you don't like the shape of your teeth, or they're crooked, a retainer unfortunately will not fix that. Retainer just holds your teeth where they're at. So retainers are great once your teeth are straightened, or if you've already had your teeth straightened and you just want to keep them from shifting anymore, a retainer will hold them in place. When you do aligners, such as with Invisalign, or the do-it-yourself aligners, Smile Direct is one example of that, right? Where they're sent to you, and you don't see a dentist for that. Or for the visits in between, you're doing that more on your own. And we are a provider for both Smile Direct and for Invisalign, so we understand the pros and cons of both. With something like Smile Direct, you're not going to get the big dramatic changes. If you have really crooked teeth, a bite that's off, you're not going to be able to fix all that on your own. But usually you can get some improvement. It just depends how far and how much it matters to you. Your cost range, on the low end, for a retainer might be a couple $100 or less. Again, that's just to hold your teeth where they're at so they don't continue to shift. If they're in a position you do not like, or you're not happy with your bite or the crowding, how they look, then you want to look at doing the at-home or in-office aligners or some type of braces. You can range on the high end of that to $6,000 or $7,000 down to $2,000 for more of the do-it-yourself at home type. There are lots of different ways to do it. Most of our patients, when we're doing aligners, they're also doing veneers or implants or whitening or fixing old silver cracked teeth, updating your smile. And so that's where we really like the in-office option for most people, because it allows us to do those simultaneously, so it saves you time. Your treatment time may be anywhere from 5 months on the low end to 2 to 3 years on the high end. Most people we see are right about in that 1 year range, because the technology continues to get better. The cool thing is we give you a box of aligners, usually anywhere between 40 and 80 aligners, and each week you change them out, and each one's a little bit different shape, and we do a digital simulation of your smile, so it shows what your teeth look like today, what they're going to look like when we're done, and then each week those aligners change and they move your teeth to that new position. So that's a lot of fun for us to share with our patients, with people like you. if you have some more questions, don't hesitate to call us or email us. Be happy to go through those with you. And we do have a couple booklets and guides we've put together that go over this in detail. And we do have some of those to give out as well. So if you're interested, we have a few copies available. Just reach out. And please leave your comments below. We'd love to answer questions for people like you, help you through this. And we look forward to seeing you on the next video, and have a great day. Thanks.